Okay, let's walk through the full building, coming in from the vestibule into the main lobby. There'll be some seating areas out here for folks who are waiting for vital records, which can be accessed from these 3 windows up front for our office support staff, birth certificates, death certificates, etc. When we go into the left, we see the main clinical area lobby. This is where patients will wait to be seen and or to be checked out by our clinical staff. So we'll start through the first door that patients will go through with our clinical staff. We come across a huddle room for our staff. We have storage, and then 2 consult rooms, consult 1 and consult room 2, where our staff can meet with patients. Turning back around, we see that main clinical waiting area. We head down the hallway. On the right is the nursing station. This is where our nurses will sit. That room in there is what we are going to call the Helmer room. It's where our vaccines will be stored. We have semi-private areas for nurses to work if they have program work they need to work on, take a call. That leads to the other side of the clinical area. We'll loop back around, come back to where we started. There's the bathroom. And then this will be like our intake area where our nurses can get weight, blood pressure, etc. And then we have 2 blood draw areas. Then we move into the lab. So this will be our main clinical lab area here. There's the second side of that where we can collect specimens through the pass-through. Then we walk into our CD lab, or our communicable disease lab. So this is specific to our communicable disease team, similar to when we did COVID testing, flu testing. This is the other part of the CD lab. So again, any communicable disease testing, whether we see an increase in cases, outbreaks, typical respiratory season for COVID, flu, etc. Good thing about this is that we also have an outside area so folks can drive up for drive-up testing. We can also do other services out of here as well. It doesn't have to just be CD. But that drive-up is a unique offering that we don't have currently at our other facilities. Come back out through the labs, and instead of going back to blood draw rooms, we'll turn and go down the hallway of exam rooms. There's the hallway where we started. Here's the other side of that nursing station where we said the Helmers would be. This is vaccine storage, etc. in here. So these spaces against the wall, that'll be where all of our fridges are. We call them Helmers for vaccine storage. And these are the exam rooms, which are much larger than the ones that we have in Hillsborough or our Arnold facilities. So we're excited for those. Each room is equipped with the same sink, the cabinets, the counter space, and we have 5 of those exam rooms. 4 along this wall here, and there's a door to the outside, kind of on the back of the building there at the end of the hallway. And then our 5th exam room is down this hallway, right here to the right. This is going to be one of our sensory-friendly exam rooms. And then we have a large amount of storage for our nursing, which we know is huge. Our storage is very limited in Hillsborough, so this will be a nice, refreshing change. Continuing down the hall, we have office space for our mobile wellness team when they come in and need a place to land. We also have office space for our nursing and community clinical supervisors as well to utilize. This is the other side of that nursing station that we saw in the beginning. And then here is where patients will exit. When they're finished with their appointments, they'll check out at those 2 windows there, walk through the lobby, and back out to the main vestibule area outside the building. But if we continue, this will be our biohazard room. And then we have staff bathroom. And then through here, we have additional storage spaces. To the right, we'll pan over and see the OSA area. So this is our office support assistant space. This is where our ladies up front, our clerical staff, will be seated. Again, there's 2 windows facing the clinical lobby, and then there's 3 windows facing just the typical normal lobby when you walk in. They'll be able to help with vital records, general questions, etc. So we have a lot of space back here. Again, a little different than what we're used to at our current facility. We walk back down the other side of the OSA area. And we'll peek in this room here. This is one of the clinical staff break areas. So full kitchen, it'll have a fridge. And this is one that's kind of over on this side of the building. And then we'll walk through to our conference area. This is the large conference room. We've been looking forward to this for a while. Nice wall of windows there. If anyone remembers our High Ridge space, this facility is actually a little bit larger. The conference room is a little bit larger. Storage for tables and chairs. This one's a little bit larger than our facility in High Ridge conference room, plus the shape is a little different. Board meetings we anticipate will take place here, so board will sit up here in the front, kind of in between those 2 pillars you can see. We will have TVs and screens in here, a lot more space for the public to attend comfortably. And we'll come out the other side here. This will be our audio and visual room here, so all of the equipment for the conference room, audio and visual, will be stored in there. Notice the 2-tone flooring, it's kind of fun. And then down that hallway is where we came originally. This is the outside of the conference room. We're going to turn back around and head towards the end of the building here. On your left, you'll see this room equipped with the sink. This is our lactation room. So that'll be available for employees and the public. We'll continue down. This is our mechanical, electrical, and engineering space. This is kind of that back corner of the building. And we'll head into the environmental lab. This is our vector lab. So our folks who do our animal bite investigations, rabies, mosquito control program, etc. This is that lab there. So we have space for testing, storing samples and specimens that come into us or that we collect. They also have a very nice view. In my opinion, they have the best view in the building. So we'll come through the other side of that lab and we'll enter into what is the common office space here. We have a supervisor office here. We believe that's going to be environmental supervisor. And then down this wall of windows here will be several cubicles that'll be open for employees. And then as we pan to the center, you'll see the huddle rooms along the sides. And in the middle here where it's all open, there will be cubicles set for employees to work out of. Again, more huddle rooms there in the back where you see these barn doors with glass. This is another storage area. We have lots of storage in this building since it's just one floor. And this is the employee break room or kitchen area here. So there'll be a fridge in here, some tables. I believe we have a countertop height there on that wall for staff for breaks, lunches, etc. We'll pan back into this open area here. Again, there will be cubicles. I believe we have 8 cubicles that will be in this section. In addition to the 4 or 5 that'll be against this wall with the windows. So we'll continue down past the huddle room area and into what we're calling our flex workspace. So there'll be some tables, chairs, bookcases, opportunity for staff to work in kind of a common area if they need to meet, or a landing zone. We next have our office. And then we are approaching the admin area. There's a look down the hallway. We're going to go into the admin area here. These will be the manager offices. So we have one office here. Another office here. That'll be the executive director's office. Notice the carpet is in this time. That's something new since the last time we did a walkthrough. An additional manager office here. And then this is a small conference room or a meeting area for the administrative team. So there'll be a table in here with a TV for screen for meeting sharing. We'll walk through this area into the other side, where we'll have 2 additional manager offices. You can see the front of the building there. All of that dirt area will be parking lot, asphalt, hopefully sooner rather than later. Pan out of those 2 offices, you can see that conference room area there and the glass on the right side. And then we're going to come out on the other side of where you'll see our flex space where we were just standing. Then we'll come up on our medium-sized conference room. So if someone doesn't need the full conference room, this one is available. To the left, we have our mail room. So this will be where employee mailboxes are, printing, postage. Continue down this hallway here. And coming up on the right, we have storage. This is an employee entrance and exit that leads you out to the front of the building. And then in here, this is our accounting area. So these are where our accounting staff will work. We have open space here for cubicles. And then we have file storage, our conference area. Again, there's the front of the building that you can peek out that window. On the other side of the open cubicle area, we have an additional room that could be used for files and storage. As well as the comptroller's office on the other side. Over here. back out through accounting. We turn back to the right and we head towards the admin area and that flex workspace. Before we get to that, we're going to turn down this last hallway that takes us to the last set of bathrooms and office areas. So over here we have staff bathrooms. In this first inlet here on the left, we have an additional huddle room, that glass barn door, 2 office spaces, it'll be kind of an open area there with a table. And over here in this corner will be an additional cubicle office space. Walk out of this inlet back into that hallway and continue left, where we'll see that main office space and those huddle rooms again, coming out the other side. Go into the second inlet over here, and we have additional offices. First here is going to be some more storage. Storage is a hot commodity in this facility. We have office space 1, and we have another office space over here. And then this area here is our storage facility for those offices. And this is our data server and IT room. So we're not going to go back there because there's a lot of trip hazards. Continue out into the main area. We'll continue left. Down here we have additional staff bathrooms. And of course, more storage. And then we're going to come back out into that main area outside the large conference room, which is where we were before. And we'll walk down towards the clinical area. That two-tone floor kind of notes where the conference room is. We head back down. There were those 3 OSA windows that we saw when we first walked in. We'll head out into the main lobby. And towards the vestibule. You can see again the main area outside. And that's it.